The bottom line is we likely will see an uptick in cases as we've seen in the European countries, particularly the UK.
I would say put your masks in a drawer, anticipate you may need them again, and hope that we don't.
In case you haven't heard, Dr. Fauci is back with more warnings. But 2 years later, we appear to have learned very little about COVID response. Dr. Fauci and the White House might want to do the very same things that have not worked before. In fact, much of the data we were working with was faulty. Studies have raised questions about the effectiveness of lockdowns and cloth masks. You can see there, lockdowns didn't stop COVID. A new study finds health experts warn cloth masks are ineffective against COVID-19. And within the past few days, the CDC reduced the total number of deaths from COVID, especially for children. They cited a coding error that led to the mess up. 24% fewer child deaths. The agency incorrectly reported more than 70,000 deaths in 26 states. 416 of them involved children. Consider this. COVID changed our lives at every level, cost taxpayers at least $1 trillion, killed nearly 800,000 Americans, and will have effects for generations to come. Much like 9/11, Pearl Harbor, the assassination of JFK. Very few events in history come close to COVID. All of those had big commissions to investigate, figure out what went wrong, what went right, and how to learn from the mistakes. Even January 6th now has a big commission in Congress, but not COVID or the COVID response. The aggressive progressive, Chris Hahn, is here with the answer to why not.
You know, there is no January 6th commission in Congress. There's a select committee. Republicans blocked the commission for
God,
January
I knew you were going
6th.
To. Okay, you know what I'm saying. Come on.
Well, let's be clear. I do support, I agree with you. There needs to be a full vetting of what happened with COVID. There needs to be a commission similar to the 9/11 commission. I worked in Congress when that commission was created for Senator Schumer at the time. And I will tell you that we should have a nonpartisan commission made up of non-elected officials, maybe former officials, judges, other experts, to really go through the data and find out what actually happened, what we did right, what we did wrong, how we can prevent this in the future, because God knows we might have another pandemic at some point in our history here in this country, and we should be prepared for it. We should learn from the mistakes we made during COVID so that we don't repeat them again.
What's stunning to me, though, is that we haven't already started on that. And there seems to be such a resistance, especially by the White House, by Dr. Fauci, by the woman at the CDC, to ever admit, oh, gee, we might have been wrong and we need to reevaluate and learn from what didn't work.
Well, perhaps it's because the pandemic isn't fully over yet. I know we feel like it's over, but there are still waves out there. And we don't want them second-guessed in the middle of the crisis. But we're going to get to a point where we have to, at some point we got to blow the whistle and say, okay, this crisis is over, it's an endemic now. And when we blow that whistle, and it should be soon, I think, Congress should go up and they should have a nonpartisan commission. Both Republicans and Democrats should join hands, sing Kumbaya, and say, let's make sure this never happens again, and let's find out what happened to begin with.
Singing Kumbaya would be a welcome thing. I don't think that's going to happen. But as much as we would all like it, then you and I wouldn't have anything to talk about. But I go back to, yes, somebody should blow the whistle. It should have happened a long time ago. But at the same level, there is just this utter resistance to say we were wrong about anything. And I can't figure out how to prescribe a non-nefarious reason to it.
Well, I don't agree with you that people haven't said they were wrong. Yes, the science has changed course.
But I've never heard Dr. Fauci say, you know what, I was wrong. We need to change course. Masks didn't work. On and on.
Well, I don't think you know a lot of doctors. Doctors rarely admit that they're wrong. But let me be very clear. He has updated his guidance, and the CDC has updated their guidance many, many times. And it's been very frustrating and confusing for most Americans. But we have to remember, this was a brand new virus.
Right,
so
but
they were
it's
learning
not
about
anymore.
it in real time.
But it's not anymore.
Exactly.
But what I can't figure out, and you from a messaging standpoint can help me with this, why, when they update their guidance for the upteenth zillion time from wear a mask, don't wear a mask, vaccinated and you're free, vaccinated, wear a mask, vaccinated, boosted, still wear a mask, now boosted, you don't need a mask, on and on and on. Why not say, you know what, we haven't quite figured this one out yet. We're going to take a little more time. It feels like we continue to go on the ready, fire, aim, CDC, Dr. Fauci guidance.
Well, I think in a perfect world, what you're saying makes perfect sense. Unfortunately, we live in a very broken society in America where people were politicizing the scientists for the first time, I think, ever. People are trying their best to try to solve this very complex problem, and they were getting attacked by people on both sides who just didn't want to do what they were asking of them. So this was way too politicized by way too many people, far too early, and it created all sorts of problems for them where they had to say, here's what we need to do now.
And maybe this commission maybe this commission would figure out what was political and what was genuine mistakes. And you still got 5-year-olds, as Chris Russell just pointed out, our EP, wearing masks in some parts of the country, which you can't imagine that's doing a lot of good. It's doing a lot of good for anybody. But anyway, Chris, we got to run. Thank you as always. It was good to see you. Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.